Drugs can be classified in many different ways, and here we will show an alternative classification for drugs by putting drugs into functionally distinct categories. These functional categories of drugs are based on the functional intent or purpose of the drug, so what this drug is being used for. And we're going to look at drugs in 4 different functional categories. The first category of drugs that we will discuss are the drugs used to replace inadequacies of naturally occurring substances. This category of drugs represents drugs that are not foreign to the body, and the therapeutic effect of these drugs is to replace normal physiological levels of a substance lacking in the patient's body. So examples of drugs in this category include hormones, such as insulin, which is used in hormone replacement therapy in patients with diabetes. Other examples of drugs in this category include neurochemicals, such as levodopa, more commonly known as L-Dopa, which is used to replace inadequate levels of dopamine in certain cases of Parkinson's disease. The second category of drugs include drugs used to combat infection and cancer. These drugs are grouped together as they both target something that's growing in the body that shouldn't be, and which can cause disease. This can include foreign organisms like bacteria, fungi, or viruses, or it can refer to cells that are growing out of control, like a cancerous tumour. And the goal of these types of treatments is to eradicate infectious or cancerous diseases, but these often involve long-term treatments. A large part of this group is made up by the antibiotics. An example of an antibiotic would be amoxicillin, which is used to treat infections such as strep throat. Other drugs in this category include cancer therapies, such as imatinib, which is used to treat cancers such as leukemias. The third category of drugs are the drugs used to change regulation. This group contains diverse drugs with many uses, and these drugs are used to change some regulatory process in the body, which often practically means they are used to treat symptoms, and they are not directly targeting the disease or disorder, but alternatively are having a dampening effect on the symptoms associated with this disease or disorder. These drugs involve regulatory changes in body systems such as the cardiovascular or nervous system, for example. An example of drugs that fall into this category are the pain relievers or analgesics, such as acetaminophen, used to treat mild to moderate pain. Another example of drugs in this category are the blood thinners or anticoagulants, such as warfarin, which is used as a blood thinner to treat people prone to blood clotting. The final category of drugs in this classification are a little different compared to these other functional categories. And this category is much more specific in that it encompasses a small number of drugs with one specific functional intent, namely drugs used to alter mood or behaviour. This class includes relatively widely used legal drugs, as well as illegal drugs or illicit drugs. An example of the legal drugs in this class include antidepressants, such as amitriptyline, used to treat depression. Clinically, these drugs are often used to treat anxiety, panic attacks, insomnia, or seizures. An example of an illicit drug in this category are the psychostimulants, such as cocaine. And although these drugs do have some therapeutic value, they are less often used due to their addictive properties. And these are the drugs that are also most associated with drug abuse and addiction. And this is due to the stimulatory nature of these drugs at certain doses. Of course, there are drugs that fall into more than one of these categories. And the reason that drugs can fall into one or more categories is because they can have multiple therapeutic effects, and so can be used to treat more than one condition. So let's look at some examples. The hormones estrogen and progesterone fall into the category drugs used to change regulation, as these drugs are found in birth control pills. And birth control pills fall into this category as they are used to regulate the reproductive system. However, these hormones are also used to treat menopause during hormone replacement therapy, and so can also fall into drugs used to replace inadequacies of naturally occurring substances, as they are replacing hormones that are lost during menopause. Another example are the opioids, which are used as pain relievers or analgesics, and so fall into drugs to change regulation, as they are used to treat pain. So the intent of this treatment is to change regulation in that it dampens down the pain response. However, at certain doses, these drugs can have a euphoric effect, and so can fall into drugs that alter mood or behaviour. But this is a secondary effect of the drug and not necessarily the functional intent of the treatment. So as we go through this course, we will look at many examples of drugs, and it is important to remember that one drug may fall into one or more functional categories. And because many drugs do fall into multiple functional categories, it is important to keep in mind all of the potential functions of a drug as you choose how to treat a patient.